Namaskar everyone, welcome to today's video. In this video we are going to understand Laxmivilas Rasa in a very simple and practical way. Laxmivilas Rasa is a classical Ayurvedic Khalviya Rasayan described in Ayurvedic text. Though it is a classical medicine, its action is very broad and deeply effective. It works as Kapha, Rasayan, Balya, Krumigna and Shotahar. This formulation contains carefully processed ingredients like Parat, Gandhak, Abrak, Bhasma, along with powerful herbs and supportive dravyas, which make it useful in many chronic disorders. In today's video, we will understand its classical reference, ingredients, method of preparation, therapeutic uses, and even modern toxicological study and related research articles in an easy and student-friendly way. So let us begin and understand why Laxmivilas Rasa is considered such a versatile and powerful Ayurvedic formulation. The Laxmivilas Rasa has ingredients like Krishna Abrak Bhasma, Shuddha Parad and Gandhak, Karpur, Jatipatri, Jaifal, Vruddha Daru seeds, Dattur seeds, Trailokya Vijay seeds, Vidari Kanda, Narayani, Nagbala and Atibala, Gokshur seeds and Nichul seeds. In this shloka, explain also method of preparation. All these ingredients are powdered and mixed thoroughly. Also, all this mixture is grounded with Parnapatra Swaras Bhavana, that is a betel leaves Bhavana, and it is then rolled into Vatika. The text here mentions the size of the Vatika is approximately 3 gunja, that is about 375 milligram. Also here in this shloka explain the therapeutic effects, that is in last line Nihanti Sannipatothan means highly effective against severe fever like condition arising from the imbalance of 3 doshas, and also explain Gadan Ghoran Chaturvidhan means 4 Gada which is so chronic like conditions, that is Sannipat, Jwara, Kshaya and Kasa Shwasa condition, and also Prameha or Kustha like conditions use Laxmivilas Rasa. This is the ingredients we use in Laxmivilas Rasa. Abrak Bhasma is in more quantity. Method of preparation we see before. Here is the organoleptic character of Laxmivilas Rasa. Katuras, Karpur Gandhi of Vati, Varna is a Raktab and Upyog as a Rasayan Karma. Store in well closed glass containers. Keep away from children. Protect from direct light, heat and moisture. Here is the dose 375 milligram. Anupan is Tambul Swaras, honey, milk, Mausras, Dadhi, Kanji, Sura, Sidhu. Roganusar Anupan. Here is the list of some adjuvants according to Doshagnata and Rogagnata. Now we see some articles regarding Laxmivilas Rasa. Here is the first article. Today I will briefly present this article, that is a pharmacotherapeutic profile of Laxmivilas Rasa, published in the Journal of Indian System of Medicine in 2015. In this article, Laxmivilas Rasa is a classical Ayurvedic herbo-mineral formulation widely used in Rasashastra practice. It is commonly known as medicine for cough, cold, sinusitis and respiratory disorder, But this review shows that the therapeutic role is much broader and scientifically significant. Aim of this article was to compile classical references, compare different formulations, and analyze ingredients and understand the pharmacological and therapeutic profile of Laxmivilas Rasa in a scientific way. One of the most important findings in this review is the 7 different formulations of Laxmivilas Rasa are mentioned in classical Ayurvedic text. Although the ingredients vary, 6 of these formulations contain Kajali base made from Shuddha Parada and Shuddha Gandhak. This Kajali base is the pharmaceutical core of Laxmivilas Rasa. It provides Yogvahi action that enhance bioavailability, improves tissue penetration, and increase the therapeutic effect of associated drugs. The review also shows that Laxmivilas Rasa is not just a respiratory medicine. It is indicated in many diseases like Kash, Shwas, Dushta Pratishay, Kustha, Prameha, Pandu, Kamla, Amvat, Shot, Rajayakshma, and Shukrakshay. This means it has action on multiple body systems, especially respiratory, digestive, urinary, reproductive, and metabolic systems. The author explains its probable mode of action through modern scientific understanding. Its effect may be due to mucolytic, bronchodilator, anti-inflammatory, antimicrobial, digestive, immunomodulatory, and rasayan action. So scientifically, Laxmivilas Rasa act as a broad spectrum multi-system Ayurvedic formulation, not merely as a cough medicine. The article concludes that Laxmivilas Rasa is a rational, clinically valuable, and pharmacologically meaningful Ayurvedic herbo-mineral medicine with wide therapeutic utility. In short, this review shows that Laxmivilas Rasa is a scientifically relevant classical formulation with strong action in respiratory, metabolic, digestive, and chronic systemic disorders. Now we see the second article. Here we see briefly summary from this article. Laxmivilas Rasa is a classical Ayurvedic herbo-mineral medicine made from purified herbal and mineral ingredients. Because of this combination, it is a powerful, fast-acting, effective in small dose, and long-lasting. Here use mainly in Kas, Shwas, Jwara, Prameha, Kustha, Rajayakshma, and Pandu. So it is mainly useful in Kapha-Vata disorders, especially respiratory and metabolic disorders. The main point of this article explains that Laxmivilas Rasa is not just one single formula. In Rasayog Sagar, there are 12 different classical types, means Patha Bheda of Laxmivilas Rasa. This means same name but different ingredients, different Bhavana Dravya, different dose, different anupan, and different uses. So one medicine name have many classical variation. Why 12 types? Each type is designed for a different disease condition such as Kapha, fever, Prameha, chronic respiratory disease, Rasayan, and Vajikaran. This shows Ayurveda is logical, flexible, and disease specific. Role of main ingredients. First is a Parath, act as a Yogvahi, increase drug action. Second is a Gandhak, reduces toxins, useful in Kapha and skin disorders. Third is a Abhrak, gives strength, useful in weakness and chronic disease. Fourth is a Tamra, which reduces Kapha, useful in cough and asthma. Also use Pipali or Trikatu, which improves digestion and absorption. Each ingredient has a specific purpose. Importance of Bhavana Dravya. Bhavana Dravya is not just grinding method. It changes potency, action, target organ action, and therapeutic effect increases. For example, here Nagvelli Swaras Bhavana for better for Kapha in Kapha. Also use Bhringaraj Swaras Bhavana, more Rasayan effect. Also use Datur Bhavana, which is useful in severe respiratory disorder. So Bhavana Dravya also direct the action of the medicine. Why it works in many diseases? Laxmivilas Rasa does many actions together, that is Dipan, Pachan, Kapha, Rasayan, Balya and Yogvahi. That is why it works in many diseases. The article concludes that Laxmivilas Rasa is a group of 12 classical formulation, not one fixed medicine. Each type has different ingredients, different action, different indications. So the correct type should be selected according to disease, dosha, patient strength and therapeutic need. Now we see the third research article. Here we see the brief explanation of this article. Laxmivilas Rasa is a classical Ayurvedic herbo-mineral medicine mentioned in Rasatarangini. It is also called as a Khalviya Rasayan because it is prepared mainly by grinding the ingredients in a mortar. It is traditionally used to improve strength, digestion, nourishment, complexions and overall vitality. This study was done to prepare Laxmivilas Rasa by classical Ayurvedic method, study its pharmaceutical process and check its quality using modern scientific tests. The aim was to scientifically standardize this traditional medicine. Laxmivilas Rasa has contained 6 ingredients mainly, that is Shuddha Parat, Shuddha Gandak, Loha Bhasma, Shuddha Kupilu, Shuddha Tankan and Marish. These are processed with 4 herbal juices, that is Adrak, Shatavari, Bhumya Malki and Rungaraj. Preparation in a simple way, that is the first all ingredients are purified to remove impurities and reduce toxicity. Then Kajali is prepared by grinding purified mercury and sulfur. Loha is converted into Loha Bhasma through purification and repeating heating. Finally, all ingredients are mixed and triturated with herbal juices and made into small tablets. Final product observations here: maroon in color, bitter and pungent in taste, smooth and fine in touch, characteristic in smell. And modern test results shows pH is 8.76, slightly alkaline. Loss on drying shows 10.94%, which shows moisture content. Water soluble extractive value is a 38%. Many active content dissolve in water. Alcohol soluble extractive value is a 0.89%. Weight variation was within limit. Particle size of Loha Bhasma is 432.69 nanometer, which is very fine, help for better absorption. Conclusion of this research article is a Laxmivilas Rasa is a well prepared classical Ayurvedic rejuvenating medicine. This study shows that it can be prepared safely using traditional method and its quality can be confirmed by modern scientific analysis. In short, Laxmivilas Rasa is a classical Ayurvedic formulation used to improve strength, digestion and vitality, and the study helps prove its quality and standardization. Now we see the fourth article, that is a toxicological study of the Ayurvedic medicine Naradiya Laxmivilas Rasa used in sinusitis. This study checked the safety of Naradiya Laxmivilas Rasa, a classical Ayurvedic herbo-mineral medicine commonly used in sinusitis, chronic skin diseases, diabetes, urinary disorders, ENT problems. The researcher wanted to know, is this medicine safe? Does long-term use cause any harmful effect? The aim of this study is to toxicological effect of Naradiya Laxmivilas Rasa when used for a long-term use. The in vivo study, experimental animal study was done on male mice for acute toxicity and male rats used for chronic toxicity. First, acute toxicity study, which is short-term safety. This test checked whether a single high dose causes immediate toxicity. Use method, Naradiya Laxmivilas Rasa was given in high doses to mice and observed for death, abnormal behavior, breathing changes, skin changes and reflex changes. Result shows that no death occurred, no major toxic sign were seen, and LD50 was found to be more than 80 ml per kg. Means a single dose of Naradiya Laxmivilas Rasa was found to be relatively safe. And in chronic toxicity study, that is a long-term safety study, this test checked what happens when Naradiya Laxmivilas Rasa is taken daily for a long time. Here use method, rat was given 100 mg per kg daily. Duration is total 32 days. Researcher observes body weight, organ weight and water content in organs. Then they shows main findings. Body weight, rat taking Naradiya Laxmivilas Rasa shows slightly weight reduction, but this was not statistically significant. Means Naradiya Laxmivilas Rasa did not cause major harmful effect on general body growth. Second is a organ weight changes. Some organs became heavier after long-term uses. That is a significant increase was seen in kidney weight and spleen weight. Other organs like liver, lungs and heart also show some increases. Means this suggests that long-term use may put stress on organs, especially kidney and spleen. Liver water content increases also. Means this may indicate changes in liver function or tissue hydration after prolonged use. Here is important conclusion, that is Naradiya Laxmivilas Rasa appears safe in single or short term use, but long term use at higher dose may cause enlargement of organ, stress on kidney, stress on spleen and possible toxic effect. So the Naradiya Laxmivilas Rasa is safe relatively when used in proper dose for short duration, but if used in high dose for long time, it may cause harmful changes in organs, especially kidney and spleen. So this way, the simple and practical understanding of Naradiya Laxmivilas Rasa, we understood that Naradiya Laxmivilas Rasa is not just a classical Ayurvedic medicine, but a broad spectrum formulation with action on cough disorders, chronic sinusitis, respiratory illness, skin diseases, immunity and chronic inflammatory conditions. Its strength lies in three important Ayurvedic principles, that is proper Shodhan, proper Maran and proper Bhavana Dravya and proper Bhasma. These processes makes the formulation more potent, more absorbable and therapeutically more effective. Classical Ayurvedic wisdom explains its wide therapeutic use, and modern study also helps us understand its safety and effect in a scientific way. This shows how beautifully classical knowledge and modern research can support each other. I hope this video helped you understand Naradiya Laxmivilas Rasa in an easy and clear way. If you found this video helpful, do like, share and subscribe for more simple Ayurvedic learning videos. Thank you for watching. Namaste.